Hello and welcome to the Winner's Circle community. I'm your host, Dr. Sean Hubbard. Each week we come together and continue the conversation on how you can win and how we can win together. And we have a guest on who cares a lot about what's going on in our society and also has expertise in that area. This week we're talking about access to care. Our guest today has big-time solutions and has brought them to our area. And his name is my friend and colleague, Dr. Jubril Oyeyemi. Dr. Oyeyemi, welcome. It's good to see you.
Thank you,
in the
Dr.
Winner's Circle.
Hubbard.
Thanks for coming.
Appreciate you.
Man, you know, you've done some wonderful things.
Thank you.
And I've gotten a lot of feedback. I've heard from people that know you. Just the other day I was in the hospital, and one of the patients there was saying that she comes to your clinic, and she was saying, I can get in there, the people are really nice, they take care of me, they listen to me. She described an experience that didn't sound like what I see in healthcare every day. And I thought, wow, that's remarkable. I don't hear people say so many good things. Because let's face it, we have a lot of things that make healthcare not that accessible, you know, feeling really, especially where we have a different language.
Correct.
The culture's different. The speed is different. Calling and getting an appointment sometimes, being seen with their insurance. I mean, all of these things make it feel like it's really not too easy to do. So, and then you go out and start a free clinic. I mean, it's amazing. So
thank you.
I wanted to understand, what was your motivation from the beginning?
Yeah, first off, thank you so much for having me, Dr. Hubbard. It's a pleasure. It's always, every opportunity to talk about the work is really a blessing, because the more people hear about it, the more we're able to let the community know that we are there for them. Because the primary mission of the clinic is to provide primary care at zero cost to the uninsured. And that was born out of the fact that I worked in a hospital, right, as a hospitalist, and I got to see different situations where community members came into the hospital with just debilitating conditions, second heart attacks, second strokes. And those got you, and usually when you got to the crux of why they were coming in, it had to do with lack of access, you know, a change in a social situation, a change in jobs or loss of a job usually, a divorce, or some social situation. And as a result of that, they were left without insurance coverage, and they had no way to access a doctor's visit to be able to get medications. And as a result of that, they were having heart attacks and strokes. And so the idea came about that, geez, you know, if folks like these in a community could only have a place to go to get their medications refilled, to get labs checked, and not worry about cost, right? And so 2016, you know, 2015, 2016, that remained an idea, and we sort of brainstormed through it. And here we are, 3.5 years later. The clinic opened in 2017, and you know, it's just amazing to see the support from the volunteer docs. Oh, by the way, it's all volunteer run, right? So all the doctors, nurses who are amazing people who already have day jobs, who still donate themselves to a cause, which is why we all went to medical school, nursing school, nurse practitioner school, PA school. That's why we all do this.
That's right.
So yeah, it's quite remarkable of a journey.
Amazing, amazing.
Thank you.
You know, I appreciate you bringing up that point, that the reasons why we went and did the studies that we did remain. We have these jobs, but we still want to give of ourselves care, expertise, and it sounds like when we come to Cherry Hill Free Clinic, we're doing that purely, really, and so that must be really fulfilling.
It is, and you know what I tell a lot of our newer clinicians about it is that, you know, unfortunately, medicine as we know it today has a lot of check boxes and, clicking and hours documenting and all those things that sort of suck the life out of it.
Yeah.
And so what I say to clinicians is, hey, listen, you come here, since we have no need to, we're not billing patients here, you do and you write what you think is necessary to pass on to the next clinician. And what's remarkable is that all those other things that add to burnout for clinicians, you come to the Cherry Hill Free Clinic and you just it's sort of a rediscovery of why you went into medicine or nursing. It's remarkable.
Wow.
Yeah.
Excellent. So you opened up in 2017?
Yes, sir.
Okay. And having opened up an office before, there was a lot to do. I mean, you had to get a handicapped accessible place, a place that was accessible to the general public, which you've done, equipment, staff. I mean, that's a lot of going on. How'd you put all that together? And I had to go, in debt to do it. I paid it, but I mean, how'd you do all that?
Yeah. It's those were all the barriers when we sat down to sort of think through, well, okay, here's the mission we're trying to accomplish, right? But here are all the things you have to put in place. Malpractice coverage for all the clinicians, space to do it, equipment like you mentioned, access to lab and radiology. It's been a journey, right? But this is perhaps the other magical part of the whole project, which is that when I say it's volunteer and donation run, right? It was like magic watching the community really, the more people heard about the project, the more they supported it. And so what do I mean by that? The space the clinic is, which was one of the main barriers to start with, the space we're at, the local Muslim community here in Cherry Hill heard about the project and was so enthused by it as a means of serving the community and expressing faith that 4,000 square feet of space was sort of given to the project to say, hey, this was donated by GCLE, the local Muslim community.
Wow.
So there was space, right? Malpractice coverage, we were able to find a federal malpractice, which is actually offered for work like this. Then you come to equipment, right? It's been critical to have the support of a health system, a local health system like Virtual Health, right? That's donated ultrasound equipment, EKG machines, and things of that nature, right? And then you come to the issue of, well, how do you get patients lab and radiology?
Right.
And I will share this with you, Dr. Hubbard. We were, all of our donations that the public gives to the clinic is 100% of it is used towards patient care, right? Well, in the beginning, when we didn't have these relationships, we were paying for labs and radiology for patients.
Oh my goodness.
It was quite expensive.
Sure.
And so,
Wow.
so to be able to have the support of a health system to say, you know what, we are going to waive the cost of lab and radiology for these uninsured patients.
Wow.
That was amazing. So it took the community coming together to support it, and it's remarkable.
Tremendous.
Yeah,
Wow.
thank you. Yeah.
So I've been there and gotten a chance to check it out, and I think we
you.
even have some photos of when I was there that we can show. I wanted to get an idea of who comes to the clinic and what are they coming for. Yeah, there's some photos there in one of your nice rooms. Now, when I first heard about this, I thought that, okay, it's a free clinic, and so it probably is not going to look expensive, but you have been extremely resourceful, you and your team, and it doesn't look like anything is missing at all. It looks like there's extra.
Thank you for that.
Yeah, so I appreciate that. I wanted to get a sense of who is coming, just general practice, family care type, chest pain, I mean, not chest pain, but what are you seeing there?
Yeah, so a lot of the bulk of what we do, right, in terms of, again, that mission of providing primary care at zero cost to the uninsured. So a lot of what we see are chronic diseases, right? But in terms of demographics of who really the clinic is there for whoever is going through a tough time and can access medical care, because there's a degree of anxiety and stress that goes with not having access to care, especially when you need it, right?
Yes.
So a lot of times we see folks in the community who need blood pressure medications refilled. Right, so people with hypertension come to the clinic.
Yes.
Right, people who need their diabetic meds, insulin, right, filled. Right, folks who have thyroid disease, folks who have high cholesterol,
Right.
folks who have chronic kidney disease. So a lot of chronic illnesses, and the reason that's important is because our hope is to address those chronic illnesses in folks who are uninsured, so that, you know, sometime in the future they don't suffer consequences of not taking care of themselves.
Exactly.
And so, you know, the average age, I think last year I looked at, we did about 11,142 encounters last year. And when we looked at that data, the average age of our patient was 48 years old. It ranged from 16 to, I think, 82. Right? And, you know, it was something like 60% women, 40% men, and maybe less than 5%, you know, didn't identify as, you know, male or female. Yeah, it was just remarkable to see the data of who we serve. We see everybody, anybody who's in that, you know, who's uninsured and just finds himself in a jam with health insurance. Yeah.
Excellent. So now, sooner or later,
Yeah.
you have to order an MRI, a CAT scan, an ultrasound, some imaging, another, many times, barrier for people.
Yeah.
There's a way to do that for your patients that come there and they could afford it?
Yeah, so in the early days, we had relationships with radiology offices that offered discount prices to our patients, right? And you know, what we would do is screen patients to make sure they can actually afford those prices. If they can't, we would use donations given to the clinic to actually help those patients pay for those, right? But then, you know, in more recent times, those relationships we've forged with the local health systems, like Virtua, has really helped us be able to provide lab and radiology to these patients, right? The other point, though, that's worth mentioning is we make it a point to refer our patients for financial counseling, so that, because a lot of times people are actually eligible for Medicaid or, you know, or insurance through the marketplace. They just haven't, they just don't know how to navigate that, which is a whole nother issue altogether, navigating healthcare.
Yes.
So, you know, so we have a social worker who helps us sort of help those patients get access to care. And when they have health insurance, they no longer need the free clinic, which is another good thing.
And what happens when they have health insurance? So
when they have health insurance, a lot of times, you know, our patients are so gracious that, you know, they love the care they get in the clinic. They'll often ask, could they continue to get care in the clinic? But we will always recommend to them that, hey, listen, now you have access to care. You can go see a specialist. You can go get some of those things done that the clinic really could not offer you. So, a lot of times they end up seeing me at my other office, or they see some other provider. But it's yeah.
I mean, it seems like a really special place. I've been there and I've seen the culture, and I can imagine that people that after they've been going there, it must be hard for them to separate if they have health insurance. And also, some of the people that hear about the work that you guys are doing, they want to come whether they have insurance or not.
Right.
I'm just thinking.
Right. And you know, and that goes to the, you know, the culture. You know, the it's just this palpable environment of love, really, when you're there on a clinic day. Unfortunately, COVID killed some of that for us, you know, because we had to limit how many volunteers were in clinic. But still, that culture is just pervasive. Yeah.
Excellent, excellent.
Yeah.
I want to follow up on that. We're going to take a short break to have some of those bill-paying messages, and I'm going to come back and ask you the big question.
All right, sounds good.
Thanks for joining. We'll see you back after these moments.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. But it's always the same basket, and it's always in the same place. And then she acts so surprised when I find them, but, she's putting them in the same basket. Again. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
Welcome back to the Winner Circle. Dr. Sean here. We're talking to Dr. Oyeyemi. He's telling us everything about the Cherry Hill Free Clinic, a wonderful place to get health care here in South Jersey. I wanted to follow up on some of those topics that we were talking about before. Are you doing all the work, or do you have other practitioners? What's the diversity like? Because I can imagine people will see this, they'll want to come, but they won't all be speaking English and looking like us and everything.
Correct. That's a very good question, Dr. Hubbard. It's actually part of the magic of the project is that there's about 25 plus clinicians, and we keep adding more clinicians who are volunteers who donate their medical expertise, and that's doctors, MDs or DOs, right? That's nurse practitioners, that's PAs, that's nurses, right? That's medical techs and medical assistants, it's nice that, and by the way, it's all really that spans all walks, older, younger, a lot of diversity, amongst our crew, folks who are bilingual, trilingual in certain situations, right? We have clinicians that speak Spanish, Portuguese, Hindi, Urdu, and that's because we have patients that really are from those communities, right? So it's really remarkable to get to do that, and for patients who speak other languages, we have translator phones that help us make that possible. So if you're a clinician hearing this and would love to give back, donate some of your time, right? We have clinicians who do a half-day shift a month. That's all we ask of them. And I would tell you, just about all of our clinicians derive just remarkable joy in doing the work, right? One of my favorite quotes by Rumi, the 13th century poet, goes, when you practice loving and kindness, right, you are the first to benefit, right? And that's what we get out of it. It's just this rejuvenation. It's the why we all went into this.
Yes.
So I could go on and on about that. Yeah.
Yes.
Yeah.
And so we have a lot of colleagues who will look at this, and how would they connect with Cherry Hill Free Clinic
Great question.
to offer?
Yes. So cherryhillfreeclinic.org/volunteer, right? Right now we're taking the clinical team, the doctors, nurses, nurse practitioners, and PAs, right? Unfortunately, due to COVID restrictions, we are, some of the other roles that we would have are, we're not currently accepting volunteers for those, but we should. Hopefully by the time everyone's vaccinated in the near future, that should go back to full operations also. But if you're a doctor, nurse practitioner, PA, nurse, hearing this and you'd love to donate your time, cherryhillfreeclinic.org/volunteer.
You have a blog there or something that people like me, other practitioners, can get connected and stay connected and hear about what's going on? I know I get the emails.
Myself. Thank you for signing up for that. So you can sign up for our newsletters, and that you can do right there on the website also. but also we're active on social media, Facebook, LinkedIn, Instagram, just to, to know what's going on at the clinic.
Sure, sure.
Yeah.
So now, what's next? I mean, you have had this idea and brought it to fruition. People are getting care. I'm hearing about it, and people know about it. It's a success, really.
Thank you.
Where are we going from here?
That's a good question. So the hope is to continue to fulfill that mission of providing access to primary care for folks who are uninsured, wherever they may be, right? And so our location here in Cherry Hill, it's here because it's where the space was offered to us. Together with my leadership team, and our board, who I'm forever thankful and grateful to, right? We hope to be able to someday have a Cherry Hill Free Clinic in other counties in the future, right? Right now, it's nice that we're able to offer telemedicine. So for folks who live far away, sometimes I forgot to mention this. We have patients come all the way from North Jersey, all the way from Atlantic City, right? Just in hearing about the clinic. And so the hope is that perhaps someday we grow to a point where we're able to offer those services, right, in other counties, and the things we would need to do that are more volunteers and
Yes.
and all the other space and all those other things.
Sure,
Yeah.
sure.
Yeah.
Yes, it's a huge need, and it needs to be underscored, really, that when we have these chronic health conditions that you're talking about, high blood pressure, that's not really well treated because a person just doesn't have the medicine, they can't get prescriptions, diabetes, thyroid disease, all of these issues that are chronic, and when they remain not well controlled, they're beating up on organs and causing a crisis at some point. And so I can see that you're helping people to avoid crises in their lives. So that's awesome. That's wonderful.
Thank
Yeah,
you, thank you.
perfect.
That's the hope. I mean, I'm sure Dr. Hubbard, as a neurologist, right? A lot of the strokes really are, a lot of times they're preventable. If
90%.
Yeah.
Yeah. But yet the most common cause of disability in adults. So I love what you're doing, because I can imagine if we're doing a lot more of what you're doing, then I won't be seeing so many patients with stroke. Yeah. So that's a wonderful work that you're doing. So what keeps you balanced personally? I'm sure that you're not working all the time. You're doing some wonderful work, but what keeps you balanced?
I enjoy cycling, road cycling. That's my that's sort of my activity of choice. It's sort of a bundling of addictions, really, for me. On the exercise front, and then just just going out there and having a great time. I'm deeply grateful also for the support of my family, right? My wife of 15 years, Naima. Without her support, I could not do any of these things that I'm talking about, right?
Yes.
And my two amazing daughters, Tesneem and Mona, Tessie and Mona. Tessie's 7, Mona's 2, and so that is what kind of grounds me.
Excellent, excellent.
Yeah.
And that's important, what I hear you saying. You're going and practicing and promoting health at work, but you're also living it and exemplifying it. That sounds like a lot of balance, really.
Thank you,
So,
Trying to. Yeah. The other, there's a point you mentioned earlier, Dr. Hubbard, about, as we treat these chronic illnesses, right? One of the other things that I'm realizing also that the clinic is indirectly addressing are health disparities, right? And so I find that, for some of our community members, especially Black and brown folks, who don't have access to primary care, you look at the data on access to primary care, and you see that it's lacking in those. It's less so in those communities, and so and when I compare that to the fact that the number of minorities that we end up seeing at the clinic, even though we see everybody,
right?
But those numbers are higher relative to the percentages of those the black and brown community in the general population. Those numbers are twice, 3 times that we see in clinic.
Wow.
And so it's just interesting to see that in doing this work, and being available for folks who are uninsured, whoever they may be, but we're also addressing the disparity in healthcare, which is such an issue of our time.
Very important.
Yeah.
Very important. Well, I'm sure that people want to see this and contribute. When I met you and you told me about this wonderful project that you're doing and spearheading in our community, I told my wife about it. We were looking forward. We got a chance to come and support the gala.
Thank you.
And we've supported since then.
Thank
and
you
before
so much
then.
for that.
And I'm sure that other people want to support. How can they do that?
Yes. I like to let the public know that there's we have a 100% model and that's really driven by the fact that, again, the clinic, all the clinicians aren't getting paid from this, right? I'm not getting paid from this.
Yes.
But we have a 100% model where 100% of donations go to our patients, go to patient care. And what that means is that there are a select few folks who support the operations, of the clinic. And so if you're hearing this and would love to donate, you go to cherryhillfreeclinic.org, right? There's a donate link on there. Also, you can find us on Facebook, and just I think it's always, if you'd like to support the project, that's the opportunity there.
Yeah. Perfect.
Yeah.
Well, I'm so glad that you got a chance to come and share more about what's going on at the Cherry Hill Free Clinic.
Thank you.
And we look forward to following your progress and being a part of it.
Thank you, sir. Appreciate the opportunity to do this. And thanks for having me.
Perfect. Thanks for coming on the show. And for you watching, didn't you love what you heard there? Dr. Oyeyemi presenting the Cherry Hill Free Clinic. We should have more of not only this type of project, but more of this specific project going on in our community and our communities. We look forward to seeing you next week, Monday, every Monday actually, at 2 o'clock, and Tuesdays at 6 o'clock p.m. You can find this show also on drshawnhubbard.com. Until then, keep winning, guys. Take care. This is all...